Welcome back. We have a slight glitch, but we're going to turn it over to Dr. Lam to tell us what's happening with the coronavirus, with COVID-19 as of today here in Hong Kong and globally.
So in Hong Kong, actually, our outbreak started at the end of January for the first confirmed case input from mainland China. And then we have a peak in terms of the symptom onset for those the confirmed case in around mid-February, about 1-2 weeks after the Chinese New Year. And then so we are past that week, the peak. And however, we have increased number of cases in the past couple of days, mainly from returning travelers from Europe and also North America, because we are imposing a new quarantine measures for basically everyone who come to Hong Kong, 14-day quarantine. So people are coming back fast from abroad. So we might be expecting a second wave, so to speak, could be, which could lead to local transmission again, maybe in the coming few days. So that's the situation in Hong Kong right now. Yeah.
And how about rest of the world? And we seem to be seeing really the growth in Europe and right now in the U.S. as well. So
yes, that's quite worrying actually. So everybody knows about the situation in Korea earlier on, and then Italy, and in which the growth of number of cases is exponential, and the healthcare system is basically unable to cater all the healthcare needs of all the people. And so now I think North America and other places in Europe are going to have outbreaks as well, maybe because of they don't expect the outbreak to affect them, and also they do not have all the measures in place, especially like in terms of testing. And also, in Asia, especially in Hong Kong, because of the SARS outbreak, people are very diligent in terms of carrying out their infection control measures, including hand hygiene, also mask wearing. Which might be different in terms of probably because of cultural reasons. Hopefully with heightened awareness, things could be better or not that worse in North America and Europe.
What right now, my question for you is, as a medical practitioner, you're seeing patients.
Yes.
And you're seeing the spike here in Hong Kong. What is your personal biggest fear right now in terms of seeing this? I mean, is that a worrying trend, seeing this week the growth in numbers?
Yes, it's worrying in Hong Kong right now because we are seeing those returning travelers. Because for people who return to Hong Kong before today, they don't really need to have the quarantine period. And then some of them come back and then resume work or other activities in the community. And they might not have the opportunity to get tested, especially if they are asymptomatic. But then we know that from this infection, actually, you could be infectious maybe 1 or 2 days before you having symptoms. So especially for this outbreak, we have studies showing that a familial transmission is actually, the attack rate is actually quite high.
Familial transmission?
Yes, familial transmission is actually quite high. And then that's exactly the place where your infection control awareness would be lessened at home. So probably you're not going to wear your mask and also not going to wash your hands that frequently, or you're going to touch everything at home because you're more relaxed. So we are worried about this situation because other family members might be affected, and then from then on carry the virus back to the community. So that's quite a concern right now in Hong Kong.
I see. So that explains some of the policies that I've been seeing. In fact, one of our colleagues whose daughter is returning back from the United States, her husband works for a multinational a bank, and there is policy going on right now from the bank, the U.S. bank, saying that if you're a family member or returning from abroad, they're asking the employees to self-quarantine. So that explains the familial connection.
Yeah.
So it is something that we are also recommending to our colleagues here. And so some of the colleagues will be working from home. So that, in some ways, is interesting, is what also the cases that we've heard from, whether it's Korea or Iran, these clusters. And so the family gathering is also a concern now. That's something we should look out for the this next 2 weeks.
Yeah, right.
Okay. But I don't want us to panic, but I think it is something that in Hong Kong, we've seen this before. You were on the front line 17 years ago with SARS, and you had patients and so on. Can you talk about this current COVID-19 here in Hong Kong, compare to when you were seeing it as a doctor 17 years ago, contrasting the differences between COVID-19 and SARS?
So for SARS, so actually at that time I think November 2002 at that time, so we know that the first case of SARS happened in Guangdong at that time. But then you know that at that time we don't have so much real-time information sharing between Hong Kong and mainland China. Not to mention real-time. It's actually the communications is not as extensive as now. So we know very little. We heard a little bit of something's happening. It's actually our neighbor city in Guangdong, so neighbor province. So but we know there's something happening in there, but we don't know what exactly is happening. And then come February, and then we are seeing cases in Hong Kong, which at that time we called it atypical pneumonia, because it's not very usual in terms of the so-called clinical presentations. And then I still remember seeing our first SARS patient in my own hospital at that time in February. Actually, we didn't know that at that time. We only diagnosed her to have SARS 1-2 months later, after checking her blood afterwards. I still remember when I saw her, and actually I saw her husband outside in the waiting room. I saw her husband wearing basically like cap, gloves, and coats, and like covering up himself all the way from top to down, like coming back from an Ebola outbreak kind of situation. So I'm just wondering at the time what is happening in Guangdong. So but then we know nothing about that. We just know there's something going on in terms of like infections, and we only identified the virus in April. And then I think the rest is history. So but this time around is quite different, because we know something's happening in December already. We know there's infection ongoing in Wuhan. Although in terms of like distance, Wuhan is actually quite far away from us in terms of compared to Fushan in Guangdong. But we know something's going on, and then we heard this is a pneumonia, an atypical pneumonia, similar to last time. We heard some rumor that there could be a coronavirus again, which was confirmed in early January. And then by mid-Jan or end of Jan, we already have many reports from mainland China, official channel, that we know what the patients are suffering from, and then we know quite about the details of the clinical presentation and also other clinical information. So the communications is very different. But then it doesn't mean that we are much more well prepared, especially about the anxiety of the healthcare workers on having enough what we call personal protective equipment, PPE. And because a lot of healthcare workers still remember the painful experience during SARS at that time, and a lot of people dying from the illness. Actually, 299 people died during SARS in Hong Kong, including 8 healthcare workers. So at that time, so healthcare workers remember that well. So they are very anxious, and then because of the lack of PPE during a time in the public hospital, so we've been very concerned about that for this outbreak. But then overall, I think actually we are much more well prepared compared to last time around, I think.
It seems to me we're also a much more prepared. I mean, what happened with SARS prepare Hong Kong in some ways, and we're more prepared than maybe other parts of the world who I feel they're seeing this for the first time. And at least anecdotally, the story I'm hearing from family and friends in the U.S. and Europe, they've never seen this type of, right now, the social distancing and being at home. And at least we've had some sort of experience. Was during SARS, was there also policies of staying at home that much here in Hong Kong?
Not really, but then people stay at home most of the time because they had,
Because we were afraid.
Yeah, they're so afraid of the outbreak, so they stay at home. But we don't have like so rigid policy or mandatory kind of quarantine for them to stay at home. But then people, more or less, it's like now basically the people don't go out in SARS. Business are really bad at the time too.
Right. Just this week, I've been with friends, and many of them remember SARS from before. So I have to say, having not been here 17 years ago, I was in the U.S. seeing it from New York. So people here seem to be a lot more vigilant about, protecting, the mask as well as sanitizer. So I have to say, just on my own, I can see the difference in attitude. But one of the things that I wanted to ask you too is also about the recovery. There's been a talk recently about Japan or other cases of patients once they recover but still contracting it again. Can you verify that story? Is it true that they can contract COVID-19 again after recovery?
I think we don't have solid evidence that people would still get infected after the initial infection, because for those few case reports about people having positive after 2 negative test results, if you are referring to those situations, then probably some of those are actually their 2 negative tests might be false negative, in a sense that because we know that for this infection, the viral load peak quite early. And then in, like, for example, 2-3 weeks onwards, the virus would decrease to a level which might not be detectable by the usual PCR testing. But if you repeat it again and again, sometimes it could pick up the low level of virus again. So that's why we call it false negative, because the virus is actually still there. But then maybe because of the sample are not adequate, or you are not sampling the right place where the virus is, so that sometimes the test will be negative, instead of like they are really negative in between those two testing. And then in Hong Kong, we have the Infectious Diseases Center where most of the initial cases are been taken care in that hospital. They actually send some of the samples for testing, in which, because we have to decide when to let people go home. And for recovery, we have to test 2 samples 24 hours apart. If they are both negative, then we can let people go home. And we didn't allow them to go home as soon as we want to, because they are still having positive results. But then when they send the specimens for viral culture, they are not able to culture the virus at all. So actually, most of those viruses are actually dead in that sense. So even though sometimes we might be able to find the virus in the later sample or later in the course of the illness, but those viruses might not be actually live virus.
I see. And one of the questions that's been very interesting, and also maybe speaking from your experience with SARS, some of your peers have mentioned that COVID-19 survives best under colder temperature. In fact, it is we started in Wuhan, and also even the outbreak now in northern Italy, in Iran, temperature has something to do with it. And some are hoping that with the summer month coming on, when the weather is warmer, that we're going to see the end of COVID-19. That seems to be what happened with SARS.
Yes.
So do you, from what do you think, what's the current study, should we be looking, will warm weather kill it?
So first of all, it's true that SARS last time just started in November, just as I mentioned, in mainland China, and then came to Hong Kong in February, March, and then in May, basically it's gone from Hong Kong. And then the last case of SARS in the world was in July 2003. We do have some isolated cases afterwards, but those are not really important. And but then temperature or relative humidities are not the sole factors determining whether this virus is going to survive in the environment. So those are two important factors, but those are not the sole factors. We know that respiratory viruses tend to come in winter times because of the colder temperature and also because of the lower relative humidity. But then that also depends on other factors like human behavior. Because, for example, people would stay indoor more in enclosed space, so they have less social distancing, and so which would actually encourage respiratory tract infections transmission. So those are the other factors which would also affect whether the virus would live in the human beings during those summer months as well. And so I think it is still unknown right now whether the virus can survive summertime. But I'm a little bit worried because for like in Europe and North America right now, they still have they obviously are not having the peak yet right now. If the virus can stay in human beings or in a large population for a couple of months more, it might be able to survive the summer months as well, because they just have the large body of virus staying in the body. Just look at the example of other emerging infectious diseases, for example, like HIV or dengue. They were also from animals, okay? But they basically now using human beings as their reservoir to just survive, like dengue. This is actually one of the only known animal or mammal reservoir right now in the world. So it could be just stay here with us in the summer months as well.
Okay. But you're also an HIV specialist. You're a specialist in infection. So one of the questions I have for you, there's been, again, reading some of the literature and so on, there's been use of HIV-related drugs to test. And also right now, I understand China, because they're at the forefront, a lot of, there's been tests on drugs and vaccine samples and so on and so forth. So do you, as a medical professional, what are some of the things that you're looking at in terms of the promising relief, or if not a cure? I know it's not, we're not talking about cures, but in terms of dealing with this virus, there's been like talking about blood, using plasma and all that. So what are some of the things that you are finding personally interesting that your counterparts in China are looking at?
So people look at a number of options in terms of treatments. Okay, so one of the drug you mentioned is what we call a protease inhibitor. The one we are using right now in Hong Kong is called Kaletra. Okay, so that drug is usually used in HIV infection. It's actually an old drug. We haven't been using that much in recent years, and we have that experience in SARS and also in some cases in MERS as well. That drug might work. But then if you remember SARS, at that time we only have a limited number of cases worldwide. We have I think a total of a bit more than 8,000 cases. We at that time we tried to gather some more useful data, but then not enough patients to draw a firm conclusion on whether that drug works or not. But there's some promising results in animals, such as in small study. But so people are still investigating whether that drug is useful, although some report coming out in the past couple of days actually that drug Kaletra is not working as well as we thought. But what we are still waiting for other results, other drug reports to come back. We have some more promising drugs which has been on trials, and like some of one of those you must have heard of is the remdesivir, which people are looking actively. It seems to be working better than Kaletra in animal studies. So we are eagerly awaiting those results to come back. And people are also using other methods to treat the infection in some, like you mentioned, what we call the convalescent serum. Simply put, is using antibody from recovered patients. But this time around, it might not be so promising because the antibody seems not to be that effective. So we are still waiting for results for that as well.
Well, it seems to me compared to 17 years ago, when China, I remember, SARS came from Guangzhou. 17 years ago, we didn't have high-speed trains, right? So
Yeah.
Wuhan this time is, although it's far, but it's closer. But then also what China is doing themselves is also 17 years ago, they weren't that much involved in maybe the medical science field, the research. So is what's happening in China in terms of that research area also maybe contributing to finding, vaccines or something, is that?
Yeah. A lot of the studies are ongoing in mainland China. I think there are more than 80 studies ongoing for treatment alone. So I think hopefully they will have some promising results coming in the coming 1-2 weeks. But right now they don't have too many patients. So maybe the research will be handed over to other places right now because China, we are eagerly awaiting results from mainland China. Yeah.
Great. I wanted to mention this article that I was reading right before interviewing you, and it's really interesting. This article was January 17, 2020, SCMP article, where you were quoted, and the article is titled, 8 Ways to Avoid Catching the Flu from Wearing Masks to Getting Enough Sleep. And this was before we are now seeing what COVID-19 has happened. And I'm looking at the 8 ways, and it is still quite relevant. In fact, more relevant than ever.
Yes.
That's why I dug up, my colleague helped me dug up this article, and I highly recommend it for those of you who are interested, especially those in U.S. and Europe. It's really practical advice. In fact, it's not just for COVID-19. It says sleep, get plenty of sleep, balanced diet, exercise, of course, cleanliness, hand washing and sanitizer, build up your immunity, and avoid crowded places and those areas with poor ventilation. And also one of the last advice was no smoking. So it's going to be hard for some of the smokers in Europe, but these are the 8 points that you mentioned that, you're catching the flu. So is that those 8 seems to me also, reading that is also very much kind of what we're hearing about day to day here in Hong Kong these days.
This was before the
exactly. You were quite prescient. You hit it right on the nose.
This interview was done mainly because we are anticipating a large scale influenza outbreak in January at that time in Hong Kong. So that's why we want to do that interview, to make sure that people are well prepared for the flu outbreak. So we know that the influenza outbreak didn't really come for Hong Kong. I mean it passed quite quickly. Just in 2 weeks' time, the flu season is gone, which is very unusual for us. But you're correct. Those 8 tips, I think, still hold true, because after all, these 2 are both respiratory tract infections. They are, in terms of prevention, they are very similar. And then we have to really go back to basic in terms of immunity in infection, like the usual old saying, like balanced diet, regular exercise, adequate sleep. They all hold true. And they are actually very, very important in terms which relate to your immunity to fight against different kinds of infectious diseases.
So the advice to all of our overseas viewers, those in the States, in fact, my sister and I were having this discussion yesterday. A lot of the, she's in the United States, a lot of the gyms, a lot of places are closed. But my understanding is Central Park is still open, and people, it is still fine to go out and walk. And that's another thing. It is still very important to keep up the immunity to fight. Because right now the mortality rate we're hearing for those who have died are the ones who have preconditions. So it is still not too late to continue keeping healthy.
Yes, of course. Yes.
Okay,
yes.
Great. We want to leave some positive signs, because right now it seems to me what we're seeing, Hong Kong, it is still panicky, but I feel like we're not as, when we started the podcast, the webcast, February 14th, we were very nervous. Hong Kong was the beginning stages. The numbers would keep on climbing. And as you mentioned, last week our number actually kind of dropped. This week picked up again because of
the
returnees. So we're still, I think another advice is really also stay vigilant and still. So right now we're going to take questions from our audience from Facebook and Sligo. So some of the question I'm going to ask you, this question asks, how fast do you think a cure or will be made available, or a vaccine?
So people are doing lots of researches to try to fast track a vaccine to be used, but the vaccine, it needs a lot of studies first. So people have to find a way to have an effective vaccine, and then it needs to undergo animal studies and then human studies, and then they have to accumulate a number of subjects. And sometimes it's not easy because you need ongoing outbreaks and then to do to complete the study to have meaningful results. So in terms of timing, I think it would be expected to be at least 1 year or so, or maybe more than 1 year, to have a vaccine on the market. Yeah.
1 year, okay. And also, this other question is coming from, it's asking, the crisis has become, serious in U.S. and Europe, now the new epicenter. Seeing it from Hong Kong, do you think their healthcare system can manage a crisis? And in some ways, maybe learning from Hong Kong's healthcare system, it is important to look at that. So what do you think? Can healthcare system in the other parts in Europe and U.S. can handle this?
I think no healthcare system in the world can handle such a sudden surge in number of people having pneumonia, in which about maybe 15% of them are quite severe, and a smaller proportion of them required ICU care and also mechanical ventilation. I think no healthcare system in the world is actually able to handle that. You can just look at Italy. Northern Italy is totally not bad in terms of healthcare system and also the resource. So, but they are still not totally not adequate to handle such outbreak. So I would say that one of the key things in that you have to engage the whole community or the whole population to do the best in terms of like infection control measures, because a lot of people I heard that they compare this COVID-19 to influenza. But then the comparison is actually not fair or not valid in this case, because one of the things they mentioned is the death rate is quite low for this infection when compared to SARS and MERS. But then it's still quite high compared to influenza, first of all. And then the other thing is the death rate is much lower in younger people. So younger people may believe that they could still catch infections and then just not having any effects on it, just go on with the usual activities. But then it's very important for the younger people to understand that apart from being infected themselves, they can also act as a person who transmit the virus to, for example, older people, elderly, or people with chronic disease, which don't have such a good immunity to fight against the virus. They could still die from the illness. And it is exactly because of those severe cases which would humble the healthcare system. So that's very important. That's why we basically engage the whole population in Hong Kong to fight against the infection. That's the rationale behind.
I hope, I think the other, audience in the U.S. and Europe is looking at it, because sometimes young people, in fact, I was talking again to my sibling, and she said, I'm healthy, but healthy, like you said, can still transmit to family members or to people who are elderly. So I think it is not just, I'm healthy, I don't worry about me catching it, but it is you as a caring agent. So I know I was reading about some of the events in some of the live concerts and stuff going on in Europe or UK, and then in the US, spring break in the United States. I think there seems to be this invincibleness, but it seems also kind of foolhardy, thinking that just because they don't catch it doesn't mean they can't pass it on to others.
Exactly. Yeah.
So that's a really good message that we hope to share with our audience out there. And this other question is asking about the blood type. The latest research about blood type, I think I just read about it yesterday or earlier this week.
A, right?
Blood type, blood type O is less likely to be infected than blood A. What makes a difference? Can you kind of what?
So actually, there are a lot of genetic genetics in play about infectious diseases. But for this one, we don't know too much about, because there are a lot of postulations about why people getting the disease or more severe compared to other population. Maybe because of the genetics or blood group, maybe one of them. But we still don't know. The short answer is that some people also believe maybe Asian population may be more susceptible to the infections as well because of the expression of the receptor in the lungs. So, but there could be some of these might be true, but I think we still need more data to substantiate these claims.
This question asks about, in compared to SARS 2003, how severe is COVID-19 patients in causing permanent lung damage for those develop ARDS?
We don't have good data about this for COVID-19 yet. So we don't know.
But that is something you guys are looking at.
Yes, but at least more than 80% of people recover quite well. So, but then for those with ARDS, then we probably need to wait a little bit more about the reports of those severe cases.
And can you right now talk about, one of the questions here is asking about public hospital taking up huge burden of COVID-19 cases management. How do you think private medical sector could help during this pandemic?
I think private hospitals can actually have a very important role to play, because you know that the government prefer to have all these COVID-19 cases to be taken care in the one or two centers or in all the public hospitals. But then, and because of that, they have to shift their workload mainly to cater these acute infections or suspected cases, not just confirmed cases, also suspected cases as well. So the case was actually more than 100. Also, and they have to stop the elective surgery, and they have to stop seeing the patients actually, and they just refill the medicines to their usual patients. So in this period, I think the private hospital have to play an important role to help to take care of the other non-COVID related medical problems of our population. I know actually some doctors, I'm one of those, went back to the public hospital to help taking care of some of the outpatients, not going into the battlefield to take care in the dirty, because they have teams designated for that. And the other way is I also know that some private doctors are seeing the patients from the public service at a cheaper rate or even free of charge, because you know some of those patients in the public care, in the public service, cannot afford the service in the private hospital. So I think overall, private hospitals or private doctors have a very important role to play in these outbreaks as well.
Great. And one of the questions we have here is, will we have to continue outbreak for a while, for at least a year?
I think the feeling right now is that we're going to have this infection for a while. Yeah. Mainly because, like I mentioned, there's still very large viral load, so to speak, because we have a concept of total viral load in a population or in the world. So if we have a certain proportion of patients still having the virus, then the infection can survive the harder environmental conditions like in the summer month. So summer is hard for them. So, but then if they have a certain number of people carrying the virus for them during those summer months, they can still survive it. So right now, I think the coming 2 weeks is actually very, very important. We looked at the example in Wuhan and also in other places like or even Italy. It can be done actually. I mean, the outbreak can be stopped. You look at Wuhan, it took, I think, about 2-3 weeks for the curve to come down. And then Italy is about the same. So I'm not sure about in Europe or in North America right now. So if we are talking about 3 weeks from now, it's still like April, May. So we still have a chance to stop this, to stop the transmission, to break down the transmission link till summer. So we still have a chance, I think, but we have to prepare ourselves to fight with this virus
So we all
for
have
a long,
to play.
long time.
Even those of us who are healthy
Yes.
doesn't think we're invincible. Think we're invincible, should need to play a role. But another question is, and again, this has been, we've seen it here in Hong Kong, the closing of a lot of the public pools and also gym facilities and so on. Do you think it is safe to open swimming pool for the public in the next 1 or 2 months?
Hong Kong?
I believe this is a Hong Kong question, yes.
I think it depends on whether the second wave, I mean the returnees from abroad would play a bigger role in causing a local transmission. If there is a significant number of local transmission in the community in the coming 1-2 weeks, I think it's not safe to open up those public places, because those are the places actually favoring the virus to transmit again. So I think it's very important to look at the data in the coming 1-2 weeks in Hong Kong.
So this next 1 or 2 weeks is really critical for us.
Yes.
Because I have to say, like I said, last week I really thought traffic had increased. I feel like there was a bit of, we'll never get back to normal, but a bit more, I'm seeing friends and so on. But this week, I think everybody's been canceling events, which I think it's been wise. And because of the concern of the returnee of more visitors coming back to Hong Kong. So this next 2 weeks is really a time for us to be very vigilant. But after that, you think because of the government, as of midnight, the quarantine will set in for visitors coming from overseas, except Taiwan and Macau. So with that quarantine, you do think that after 2 weeks we will see maybe hopefully kind of a drop in the cases here in Hong Kong again?
Yeah, so we expect a drop in cases, and also we expect by the time if we are going to open up the public places like gym and swimming pool, and then we expect there is no significant local transmission, and also no local case with I mean, the number of local cases with no obvious source should be minimal or zero before we consider to open up those public places.
Okay. I think we've covered a lot of the questions, but one of the things that I also wanted to ask you, and we were talking about earlier in terms of youth, and you're not dealing with young patients, but again, the question this last couple of weeks we've been asking, it is really because the young people, the kids, their immune is quite different.
Yeah.
They are not suffering, and is it kind of similar to when SARS happened? The children were not as severely infected as elderly. Is that similar?
Yes, similar for SARS, MERS, and also for these COVID-19 as well, but not with other human coronaviruses actually, because a lot of the other 4 types of human coronaviruses affect kids as well, and there's no good biological reason why kids would be immune to this infection. So one of the possibilities is that actually kids can actually be infected with the virus, but they are not having really severe infection. They are not having symptoms at all. So they might not be tested. So we don't know that actually kids carry the virus. And that's exactly the reason why we have to protect our kids as well, because the kids can also transmit the virus to other people. So that's one thing we have to remember as well. Mm-hmm.
I think this question came from, we were talking about earlier about the public hospital and the private hospital, and having visited Gleneagles, is a beautiful facility in Wong Chuk Hom. How does your hospital, Gleneagles, as a private hospital, how coordination with a public hospital or with the hospital authority in terms of this outbreak?
So we have been for most of the private hospital, we have been looking up to the Center for Health Protection for the upholding like the infection control measures, and also make sure that people are following the general rules or guidelines from including those like people coming back with symptoms of fever, make sure they get tested. And because most of those tests are currently done in the public hospital, so we have to advise people to go to a public hospital to get tested. So private hospital in general, like I mentioned, helps to take care of people with non-COVID related problems at this moment of time. Yeah.
And we were talking about this earlier too, also in terms of influenza getting shots for the vaccine. Is it too late now, or I think you had mentioned the optimum time might have been October, November.
Yes. Yes.
But somebody like me who did not get my flu shot, is it too late now to do something about that? I guess right now we have time, so we were talking. Can you kind of align about that?
Sure. So the timing of influenza vaccines is actually designed to be given in October, November in Hong Kong, because usually the peak of the winter, the surge is in January. And because of the influenza to work to have effective immune response in the person, it takes about 2 to 4 weeks for it to work. So it has to be given at least a month before. And also because of the effectiveness of the flu vaccine would last probably about a few months. And then by 6 months, the effectiveness would actually be reduced about 50% or so. So it might be wise for you to have the vaccination about a month or two before peak season. For us in Hong Kong, we have 2 peaks for influenza activity. One in January, the other one is in the summertime, actually, in July, August. So it's not too late to get the influenza vaccination. So now is March. Maybe you can have the influenza injections in 1 or 2 months later. Yeah.
Great. I definitely will do that, because one thing this has really taught me is I remember thinking about it in December in the U.S. and just thinking, oh, I'm fine, I don't need it. But I think in some ways the lessons of this COVID-19 is, for me and here in Hong Kong, really staying healthy. I think some of the stuff we take it for granted.
Yeah.
And it's when you're healthy, you can have the immunity to fight something like this. Because in some ways, in your career, and I'm looking at the COVID-19, yes, we've seen SARS, we've seen MERS, we've seen, and I remember in New York seeing Ebola, the spread of it coming from Africa. But they have all been taken care of. I'm not seeing something like this that has affected in the scale, right? I'm trying to think. This one seems to me is now touching, and in fact, there has been fear now that the developed countries are getting it, and if it hits the developing nations, it might be even worse. But
yes, true.
Professionally, I mean, that's something that, and also I feel like there are lessons that we can learn from what's happening, the successful dealing of it, first in Wuhan and now in Hong Kong and Singapore, but right now it seems to be everybody's still panicking again. You're hearing about whether it's Europe or U.S. or rest of Asia. So what is some of the advice that that you can give? Now, I feel like we're also giving similar advice to some of our centers in terms of lessons learned. We're ahead of the curve. What are some things that you think your counterparts in Europe and other parts of the world, what would you advise?
I think we have to really work as a team, not just like for people, or not just for specialists or in infectious disease or in public health. Everybody has to work as a team. And I think also be open to possibilities instead of like, because the outbreak is quite dynamic. You have to make sure that you open up to listen to other people and to make sure that doing the right thing at appropriate time. Because, for example, one of the issues we've been debating in Hong Kong for the past couple of weeks, whether we should have universal masking or not. Okay, that's also
mask or not to mask.
Yes. So that caused a great debate even among ourselves. So that's something we have to learn to be open to opinions, and also just to make sure that we do the right thing at the right moments. if it for like I know, for example, for this example, the WHO do not recommend people to wear a mask, and then but we have to think carefully about what is happening and what we don't know, and be open and to make sure that we do the right thing.
I think your point, that's a question we've asked almost every one on board. And some of the experts we've been asking were talking to us from whether it's Geneva or U.S. But now that I live here, and and I'm still using the MTR, the public transportation, just seeing everybody wearing the mask, it's almost like a courtesy. I remember going to Japan, traveling to Japan, 10, 20 years ago, when people just you see people wearing masks in Japan.
Yeah, right.
And in Hong Kong, after SARS, I remember seeing more people wearing masks when they're sick. So the mask question is something that I feel, if you're going to get on the MTR, wear it, or the taxi and so on and so forth. But when I'm walking around campus, I don't wear it because there's fresh air. And so I guess it's very much, and also Hong Kong is a very densely, one of the most densely populated places in the world. So because we now are even talking about housing estates, they're worrying about the pipes and so on and so forth. In Hong Kong with SARS, we've had that experience of people living literally on top of each other and contracting SARS that way. So I guess the mask question has to be to each his own, to each country his own.
Yes.
And but somebody was telling me in the States, I don't need a mask, I drive to work, right, in the United States. So I guess I can see that rationale. But here in Hong Kong, I guess I always have a mask in my bag as a courtesy. So I think that's a very good point that you raise about the mask question, and also the sanitizing question. But on that, I really want to thank Dr. Lam for your wonderful advice and your experience in that, and also assuring our Asia Society audience that we shall overcome. And I think we have to do this together. Whether Hong Kong, we have some experiences, and China as well, and sharing it with our viewers out there, and also be positive. I think this last week I feel the sense of community. We all are learning from each other, and especially this week, a lot of people have voluntarily saying, my kids just came back from the States. Let's just do a Zoom conference or texting each other and so on. So I think social distancing does not mean we don't listen to each other or learn from each other. So I hope that's a message that we can get across to our audience. And on that note, I want to kind of do some advertising for Asia Society as a global center. In fact, this week, tomorrow, Asia Society will be doing another live webcast out of New York. And this is from our colleague at ASPI, Asia Society Policy Institute. The impact of coronavirus on China's economy, politics, and U.S.-China relations. And this will be with our president of ASPI, Kevin Rudds, in conversation with our vice president, Tom Nagorski. And that happens March 19th, 9 p.m. Eastern time. So it'll be Friday morning, 9 a.m. And this is the wonderful Asia Society Network. Also on our Asia Society AsiaSociety.org, you will also find a coronavirus crisis with all the updated information, including all the webcasting that Asia Society are doing, whether it's from Hong Kong, Switzerland, New York, San Francisco, Texas. So please stay informed on AsiaSociety.org. And really, we look forward to bringing you episode 7, which will be next Thursday, with Professor Mark Lipsitch from Harvard, T.H. Chan School of Public Health. So join us next week. And I have a feeling we're going to continue this. When we started this in February, we really thought it would be a short term. But as this global pandemic develops, Asia Society will continue to bring you up to date, the latest from experts like Dr. Lam, and also talking about the business and policy implications of this global pandemic. So thank you all for joining us, and we look forward to speaking with you next Thursday. Thank you.